Mhm. KJ.
Ikispigara evanguru.
All right. Good evening, ladies and gentlemen who have joined us via multiple social media platforms. My name is Dr. Fundi Lenyati. I'm the host of this Dr. Fundi channel. Today, we have a special guest, and our special guest is somebody I know for a long time. You know, somebody that I've worked with for about 5 years. But you know, we decided that as we are continuing to celebrate women who have done great things in their respective or chosen professions, today we are actually celebrating Miss Kagiso Motseto. All right. So today we are here to celebrate Kagiso Motseto. All right. I normally refer to her with her clan name, which is Khabo. You know, that's her clan name. Those who've worked with me, they will know that I like to refer to people with their clan names. Now, Miss Motseto is still battling connection. You know, so she should be joining us any moment now. But what she has done was to also circulate the meeting details for our conversation. So we've got a lot of people who have joined us who at a certain point, I will, you know, speak to one or two of them, you know, to give their testimonies about how they experience Miss Motseto. All right. So whilst we are waiting for Kagiso to join us, let me just tell you a little bit about who Kagiso is. Right. Kagiso, or KG, she is the managing director of Remotlotlo Health, a company that's about 7 years old. She's a qualified occupational therapist, a very experienced occupational therapist. She's been in practice now for almost 23 years as an occupational therapist. She qualified in 1997 at Medunsa. And in that period, she has, you know, got a lot of experience in clinical OT in hospital. She has also been a lecturer teaching students who are doing occupational therapy at Wits University. She has worked for big corporate in the area of, you know, health consulting on incapacity and disability. And also, she has worked for our company here, Proactive Health Solutions. That's where we, you know, we shared time with her for about a 5-year period, where she joined us as a junior incapacity consultant. You know, then she became our ops manager for the Gauteng region. She became our customer relations manager, and she also became our national operations manager. So in that 5-year period, she actually grew within our organization, and she got to a point where she felt I needed to go and set up my own venture. And you know, that's something that you must always expect. If you you know, develop people, at a certain point they will outgrow where you are with them and want to go and spread their wings elsewhere. And so in 2013, she started her own company, Remotlotlo Health. And so today we're gonna be hearing from Kagiso about her company, Remotlotlo Health. What does it do? But before we hear about that, we'll also just get to know about the profession that she chose, which is occupational therapy, because a lot of people out there still don't have a clear understanding of what occupational therapists do. So by actually showcasing Kagiso's, journey. We'll also be touching on, the profession that she chose, why she chose it, what do they do, what are the benefits of making use of occupational therapists, especially in the workplace and all of that. So, yeah, let's just be patient. She's still trying to join us. All right, so Kagiso, like I said, she spent 5 years with us and then went and started her own company. But besides her qualifying as an occupational therapist, she also, acquired business management and business leadership, qualifications. So she did an MDP from GIBS, which is Gordon's Institute of Business Science, where she got, deep knowledge around management, and also leadership of, businesses and organizations. She has gone further to add other skills, in her in a basket of skills, some business skills, especially on the financial management side of things, and also added deeper skills also on the clinical side of things, on things like functional capacity assessments, and also qualifying to use the guidelines of what we call the AMA. And she has gone further to also study around how to design return to work programs, and be able to make those fitness for duty kind of decisions. So basically, we're talking here about somebody who is a clinician, but also somebody who has been able to make a transition from just being a pure clinician to being a business leader and a manager. So I'm still just waiting for her to join us. I'm not sure exactly why she is struggling to join in with us. But like I said, there's many other people who have joined us. Those are her close friends, people who are supporting her. So I will not, remove them. We will just continue to converse with Kagiso, and then at the right time, I'll pick up one or two of them, to just get their perspective of, this person that we are profiling today, which is Kagiso. So just bear with us. She should be in any moment now. So yeah, apologies for this delay. Our guest of honor is still struggling with some technology. She had tried to come in via her laptop, but for some reason, her laptop was not connecting. So she was going to use her smartphone. And so, but she should be in by now. But just bear with us. I'm sure once she's in, we'll have a lovely conversation. There is so much that we will learn from her, because the purpose of these conversations, which I call Mbogodo conversations, is really to get to know a person. Who is she? Where does she come from? What kind of family did she grow up in? What kind of influences that have shaped her, so that even now that she's a working adult, there are still things that she does based on the values or the principles that she learned as she was growing up. So we want to know all of that. Yes, we will spend a lot of time around her choice of profession. Hopefully, she will educate some of us about that profession. But also, we will then focus on her deciding to become an entrepreneur. How easy or how difficult was that transition? And her 7 years as an entrepreneur, to find out, what has been her experience of actually employing yourself, where you don't have a guaranteed, salary. You have to pay everybody else, and you as the owner are the last one, to be paid. We want to get all of those kind of things from her. But whilst waiting for her, I'm gonna ask one of the ladies that I worked with briefly, Success Muwahi. I think I'm going to hijack her. Success, can you hear me? Please unmute yourself. Hi, how are you? Success? Can you hear me?
You.
Yeah, I'm hijacking.
Yes, I can hear you well.
Yeah.
Can you hear me?
I can hear you.
Yes, I can hear you. I
Yeah.
can hear you.
All right. We're still waiting for Kagiso to join us. But whilst waiting for her, I'm going to ask you to just tell us a little bit about you and Kagiso. Where do you know her from?
Maybe I should exit because I think the number of audience is more than
Oh,
what
don't
you
worry.
anticipate.
Don't worry. Don't worry. I'm now asking you a question. Answer my question whilst I'm waiting for Kagiso. You guys are both occupational therapists. You are colleagues. She invited you to follow this conversation, and I know you as well. So, yeah, just tell me a little bit about Kagiso.
Okay, I think me and Kagiso are friends, and we've known each other since we started at Medunsa. I think it was in 1995. We studied occupational therapy together in Medunsa, and we graduated together. We've been best friends, and what I can say is I'm so proud of where she is now, and I look up to her, and she's one of the people who are perfectionists and very consistent and don't like to take chances and make sure that whatever she does is for the best. And what I can say is I was looking forward to hear about her because I know she deserves such platforms, and I know she's best in such platforms. And she's great. She's a professional. She's she likes to excel in what she's doing. And there she is, and she's so beautiful and still remains beautiful. And yes, there she is, and I can be giving you, and that's it.
I'm happy with the preaching that you did without you preparing, and please don't leave us. You're gonna stay there at the right time. I'm gonna come back to you. All right. Okay. So, but anyway, thank you, Success. And let's welcome our guest of honor, Miss Kagiso Motseto. KG, unmute yourself, please.
Yes, good evening, I'm here.
Yeah,
can you hear me now?
You know, this thing of somebody, you bring somebody from Harman's Kral, and you want to upgrade them, and then they struggle with technology, it's a problem.
My apologies, Dr. Fundi, and to your viewers as well. I did have technical challenges, but really, I don't take you for granted for waiting for me. My apologies indeed. Sorry.
No, Success tried to close the gap whilst I was waiting for you. So, and she did an excellent job. All right.
Thank you so much. Yeah.
All right. I think let's start afresh. Okay. Let me introduce you properly. All right.
Yes.
Good evening, ladies and gentlemen who have joined us via multiple social media platforms. My name is Dr. Fundi Lenyati. I'm the host of this Dr. Fundi channel. Today, as part of our profiling of women, phenomenal women in our country, we have invited Ms. Kagiso Motseto, to be our guest of honor. I normally refer to her as KG or just Khabo, which is her clan name. Right, she is the MD of Remotlotlo Health, a company that's about 7 years old. It's a company that specializes on issues around, around occupational therapy and other workplace solutions. She's a qualified, OT, qualified in 1997. So she's been an OT for about 23 years now. She has played a role at a clinical level in hospital. She's been a lecturer at WITS. She has worked for big firms, like Alexander Forbes. She's also worked for small firms like PHS. And she keeps on just adding skills to her CV. She's got a diploma in advanced OT from WITS University. She acquired leadership and management skills from GIBS, that is Gordon's Institute of Business Science. It was in 2008. And she's just continued to add, finance for non-financial managers so that she can be able to manage the finances of her business, Remotlotlo Health. And but because it's an owner-managed, clinical practice, she also has to continuously add clinical skills. So, Kagiso, welcome to the Dr. Fundi channel.
Thank you so much, Dr. Nyati. Thank you for the opportunity, and I really feel humbled. You've hosted phenomenal women on this platform over this Women's Month, and when you approached me to be part of the ladies that you feature this month, I felt really humbled. You and I have come a long way, and I guess part of tonight is that your audience will get to find out that in your journey as a health professional and as an entrepreneur, you have also contributed towards the grooming and mentoring of young women. I still consider myself young, yes. And within our sector. So it really is a pleasure to be here. And I'm looking forward to an engaging conversation.
Lovely, lovely, lovely. This is about you today, not about me, okay? This is about you. So I want people to know you. And the first thing you can tell us, who's Kagiso?
Sure. Kagiso is the second daughter of Kagiso Motseto and the late Ernest Motseto. I'm the second born of 5 children. So I have 4 siblings. I have an older sister. I have 2 younger brothers, and then the baby sister of the family. She's not such a baby anymore, but yeah. So I was actually born in Soweto. My mother reminded me that when she was pregnant with me, it was in the midst of the uprising, the Soweto uprising. But grew up in the Northwest, in Mafikeng, because that's where my mom is from. So, my maternal great-parents were based in Mafikeng, and that's where my mother is. And that's where my mom and dad met, in Mafikeng, actually. Oh. So that is just me. My dad in Mafikeng was actually a deputy principal in a school for children with physical disabilities. Okay. So I guess later on we'll get to learn how that shaped and groomed me into the person that I became and the professional that I became. So that is where I grew up, so in Mafikeng. So I started school at the age of 4.
Yeah.
Most people would be like, at 4? I'm like, yes. So because of the environment that we grew up in, there wasn't a school I could go to. And so my parents decided, because my sibling is the one who comes after me, a year and 20 days younger than I am, was already there. So they sent me off to school to say, go and be busy at school. We don't know what they do there. So I actually attended my grade 1 in a class with children that had physical disabilities, in wheelchairs. Some rode with their feet, some I mean, you know, and it just became part of normal life. For me, they were my friends. We spent time together. And that's how that first year went. At the end of the year, the teacher said, well, here's a report, go give to your parents. My parents opened the report and it said I had passed. So then I had to go to grade 2. So basically that's how it went. I was in grade 2, but I couldn't continue in that school. I needed to go to a different school now with able-bodied children. That's why I did my grade 2. In grade 3, another interesting incident that I think shaped a little bit of what I do now. My dad got a promotion and he moved to a school in Rustenburg called Kutlano. That was a school for children that, that was a school for children that, with the children that suffered with deafness. So we stayed with my dad at that school because my mom had stayed behind in Mafikeng. And interestingly, because we were surrounded with kids that had hearing and speech impairments, we communicated in sign language. So my brother and I, who lived with our dad at that point, also started communicating in sign language. I remember the one weekend my mom came home and she couldn't talk to us because we just communicated in sign language. So, and it was an interesting thing because, I mean, our friends spoke the sign language, so that was the only way we can communicate. So that really where I spent my formative years until we then later moved closer to dad's home, which is in Hammarskraal, which is where I did my primary school, my middle school, and my high school. So pretty much that's
so it seems like your early years were actually they had a lot of influence in terms of what you ultimately became. I mean, your first year of schooling, you are with people with disabilities, right? You were with people with disabilities. And your grade 3, you were with people who also had, hearing, disabilities. So I think there was no way that you were going to miss that influence, and your dad, obviously, being somebody, was he a principal in those schools?
He was a deputy principal.
Yeah. Okay. Lovely. Lovely. And mom was also a teacher, right?
Mom is also a teacher, yes. Mom is also a teacher. So she taught at different schools, but she was not in the same school where my dad was. She taught mainly in high school. She's an avid teacher through and through, taught biology and English. I still remember my biology taught by mom. Up to now, I can tell you all the components of the heart and how it works and everything. So that was just the kind of, mom that she was. She wanted to make sure that we achieved and we did well. So she really did contribute towards making sure that we achieved at home.
Right. So if I look at the fact that both your parents had an influence in you, what would you say is the main thing, or value or whatever, that you got from your dad, that has shaped how you do things, and also from your mom? When you look back and say, this one, definitely it's my mom. This one is my dad,
Bella, I think the one thing that I took from my father is that our dad was never someone that accepted mediocrity. He always expected us to perform. I was having a conversation the other day with my sister that if he was still around, he's late and may his soul rest in peace. If he was still around, we would have all been on our way to our PhDs right now. So we've since slacked off, but he expected us to perform. He, when you came home and you got a number 2 or number 3 in class, remember those days we had number 1 and number 2 and number 3, he would be like, well done, my child, you did well, but come and tell me, why didn't you get number 1? Why did you get number 2? So,
so you guys had to perform.
Yes, you had to perform. So, and he did not take anything, lightly. So that for me was instilled at a young age that you work hard. You work hard for what you want. You aim for the stars and you push. And you don't just sit and lie around and think that things are going to end up on your lap or they're going to be given to you. So that's what I got from him. And in his later years, when he left teaching, he went into business himself. He did different types of businesses. He just was not the type of person that would say, I'm a teacher and therefore I cannot go in and do auctioning. I mean, at some point he, ran an auctioneering firm. I knew nothing about auctioneering, but he was there and he was saying, I'm going to go and find out and learn what it is, to auction stuff. And then mom, at the age of 38 or 39, my mom decided to leave teaching to go and study full time. 5 children, married and everything. She decided she wanted to get her psychology degree. So she left and she went to study at Vista University. And my dad took care of us and the family at that time. Yeah. So she went to school, studied, and graduated cum laude for a degree. So
yeah, Abela, when you are an ABET candidate with all of that sacrifice, you can't just get 51%. You need to, to show also, to show you guys that you must aim high. Yeah.
Exactly. So she then went on to study at that stage, and that for me just said, you are never too old to achieve what it is that you want to achieve. You've got to aim and you've got to focus. She went on after she got her bachelor's degree to get her honors degree. So my mom is a qualified psychometrist. She could actually do that. She just shows the love for teaching because she was so passionate about it and she stayed with it. So that as well. She's the heart of the family, and she gave us a lot of the values that we we've got and we carried as children within the family. So yeah, I guess that is the family that I grew up in.
But now, how has that or those studies in psychology affected the way she parented you guys?
Interestingly, she was also a guidance counselor at school. So, and I guess that also informed the fact that she would, when I went into my career and the choice of career that I got, it was because of her influence and because of the knowledge that she had as a career guidance teacher. So the fact that she went to school, she came back, I think that broadened her knowledge in terms of the discussions, in terms of the careers that were out there. And therefore, when she guided us to say, this is what I think you should study, this is what you should explore as children, that helped us to shape us and to make choices later on. So,
lovely,
yeah.
Lovely. All right. So then you went to Hammanskraal. That's where you went to do your high school, right?
Yes.
All right. So the change from Mafeking to Hammanskraal?
I was still very young. So the change for me didn't really, I finished school at 15. So when we went to Hammanskraal, I was probably about 9 or 10. So at that point, I was still young. I was just being told, we are going to move to Hammanskraal. We are moving from Mafeking. We are moving to, a more township area. My dad built his first house and his second house in Hammanskraal. I now got to be more exposed to people that were from, my father's side of the family. And I guess, it was time for me to be more independent. And so the adjustment was not so difficult. Yeah.
All right. So at what point then did you decide on which career to pursue? This is high school now. You need to start saying what subjects I must do, which ones I must drop, and start getting some guidance and stuff. So did you always want to do occupational therapy, or it's something that came later, in your high school years when you were about to apply?
I knew that I wanted to do something in the medical fraternity. I knew that I have a passion for working with people, for assisting people, for making a difference in people's lives. And I wasn't quite clear as to how that will shape out ultimately. And so I knew leaving middle school then, going into high school, that I needed to go into a science class. So that's a class that I went into. And not that my parents gave me much option, they didn't.
Yeah.
Back then you're told you're going to study science and you went, okay, that's what I was going to study. And that's the class that I went into. So in standard 8, 9, and 10, I enjoyed my high school. I was in the debating team. I participated in activities at school. I just wasn't sure. But in grade 12, my mom sat me down and said, okay, you want to do something in the medical field. So let us explore the options. Let us look at what's available. And she mentioned occupational therapy to me. And I remember asking, but what is occupational therapy? She said, well, I actually think I've got a good idea. I need you to go and do vacation work at the hospital so that you can understand what occupational therapy is. So during June vacation in Standard 9, my mom shipped me off in December to go and look at what occupational therapists do in hospital.
So, sorry. So Standard 9 is what people refer to as grade 11 nowadays, ne? You just revealed your age, Kagiso. Right.
I'm not shy of my age, but yeah, it was Standard 9 back then. So she then took me to Jubilee Hospital, and that's where I spent time with occupational therapists, understanding that. And I must say, when I went to hospital, I thought that occupational therapists only work with children and they work with adults that have been injured in terms of offering them rehabilitation. So that is the limited information I had. I was drawn to it and I felt I could make a difference in this field. And yeah, when I got to Standard 10/grade 12, I then made applications to vets, to Medunsa, to the different universities, yeah, to go into occupational therapy.
Yeah. All right. So how many of those universities accepted you?
Do I remember?
You know what I'm getting to. I want to know, was Medunsa your first choice?
Yeah.
You know, or there were other considerations that made you to choose to go there, you know? Yeah.
I had never been away from home. So for me, going to university, I felt I needed to gain my space and freedom. And so I think I applied to UCT, I applied to vets, I applied to Medunsa. And I got accepted into vets to study my first year at vets. So that was, for me, was quite exciting. So that's why I did.
Why did you want to be far away from the parents?
I had never been. I grew up, I was under my parents' wings. And for me, it was an opportunity to say, go and see the world, go and see who you are on your own, you know, as an independent person and without the influence of, you know, or being under the watch of your parents all the time. So that's why I felt that vets was a better choice. Yeah. All
right. So you went to vets, but you did only 1 year. Why?
Vets was too nice. I remember when I got to vets, I was 15. I turned 16 at my first year at vets. And after my mother helped me with the room and getting organized, she cried. For the first time, my mother felt I was too young, you know, to be left on my own. And I guess that was part of some of the earlier decisions that had been made, catching up with her to say, even though I was academically ready to continue with schooling, but emotionally, she wasn't sure whether I'm ready to take that first step. And I must say, Belle, that first year was a challenge from an emotional growth point of view, because as I said, I was on my own. I needed to develop my wings and find myself and grow. And therefore, it then presented its own challenges. I got to write exams, and at the end of the year, I did not pass all my exams, and my father was not happy with me, as you can imagine. I wrote my supplementary exams, and those were still not successful. So I was given the option to repeat the whole year in occupational therapy again, and I opted no. I would rather go to a different institution. So it was a year of learning. It was difficult. It was the first instance of failure that I had encountered in my life. And I found it difficult to deal with. Yeah, but it was a learning curve.
Okay, all right, that's fine. But what were you doing? What distracted you?
Doctor, yes, I was studying very hard.
All right, let's move on. So you went to Medunsa.
Yes.
And they accepted you. Did you start
Yes.
afresh at Medunsa, or they credited you with some of the courses that you had already done at Wits?
I got credits at Medunsa, which was really great. And I must say, when I say that it was part of the learnings for me, my dad, when I failed at Wits, refused to go with me to Medunsa. He said, if this is the step you want to take, you are going to take it on your own. You are going to take responsibility and you're going to get yourself registered into this course that you want to do in Medunsa. And that was also teaching me to take accountability for the year that I'd spent at Wits and wasting his money. Yeah. So I got to Wits. I had an interview with the head of the department, which was very daunting. Pardon?
Wits or Medunsa?
At Medunsa. Okay. The head of the department asked me, but why should I take you? You're a reject from Wits. You failed. And I said to her that I have learned, and I'm prepared to exert myself and to be a shining example of, what a student should do in university. And indeed, I think I got accepted. I got credited for some of the courses that I had passed at Wits, and I started my journey at Medunsa. Yeah.
Yes. Much more wiser.
Much more wiser. Yes.
So
much more.
Yeah.
Yeah.
All right. So what are the highlights? I want us to move to the working life now. But what were the highlights at Wits?
At Wits.
Sorry, man. At Medunsa. Yeah, Medunsa.
It was Medunsa was it was different environment from Wits. I learned to the totality of occupational therapy. I learned the various areas that occupational therapists work in. I developed relationships with the people that worked in the OT department, and I did well. I excelled in my subjects at school. That's where I met Success Moahi, the lady that you had that I was holding with the fort in my absence. Yeah. And we formed very good relationships and bonds. We studied anatomy together. We studied physiology together. We did our practicals together. So yeah, it was 4 years of hard work, absolute hard work and dedication, because I needed to prove to my parents that I could make this work.
Yeah. So any awards that you got during your time there that showed that you really were now you attend a new leaf?
I did. For every year I think my mother was invited for an award service from the first year for exceptional service. So meaning that I was averaging 75% in my subjects. So that's I think I have the first year, second year, and third year, the certificates for outstanding performance.
Yeah. And your final year?
No. Final year, only subjects. I got some subjects with distinctions, but not overall performance. It was hard.
Okay, lovely, lovely. Now, you qualified as an OT. For majority of people, we don't understand what the field of occupational therapy is all about. So before I ask you about your journey in OT, I want you to just take a minute or two to just explain. For me, the first time I got to understand what an OT is was when we started this company in year 2000. That was like 10 years after qualifying as a doctor. All right. So there is this problem of compartmentalization of healthcare disciplines, where we just focus on our own little corner. We don't know what the other healthcare worker does and stuff. So for me, I got to know about you guys very late when I had to start a company. So I want to now, for people who are watching, who don't know what an OT is, what is an occupational therapist? Where do they fit in the continuum of healthcare?
Okay. An occupational therapist is a healthcare professional that works in a hospital in different settings. We mainly work in rehabilitation centers, in hospitals, in conjunction with physiotherapists. And we mainly look at, is a client-centered profession that looks at the use of daily activities in order to optimize performance in day-to-day occupation. So we use specific activities and tasks to be able to rehabilitate our clients, to be able to perform better in their day-to-day tasks.
All right.
And yeah, so it is mainly rehabilitation through the use of selected therapeutic activities.
Yes, but now earlier you talked about OTs and kids, you know,
Yes.
in the education space. So I'm a bit confused.
Okay, occupational therapies with children. We work with children, we work with adults, we work with a person literally from throughout the spectrum of life. With children, we look at the use of therapeutic activities to assist them to be able to function optimally in schooling environment, in activities of play. So would then do assessments to say, what are some of the impairments that they may have from a cognitive perspective or perceptual perspective. We would then choose specific tasks or activities that would then assist them or treat them to function optimally in the schooling environment or play environment. And because children enjoy play, would then use play-centered tasks to be able to facilitate the components that we want to achieve. We want to improve concentration with them. We would then look at a puzzle that would engage them. Depending on their age, depending on their capabilities, we would look at something that would demand of them to focus for 15 minutes. Next time, we would improve it to a task that has got a puzzle that has got 12 pieces to improve their concentration to 20 minutes. So it's specifically chosen activities that are then used as part of treatment and rehabilitation. Then that's mainly what it would be like in a children. Yeah, with children.
So kids who've got learning difficulties, you guys are central there in being part of the solution.
Correct. Most parents do not know what occupational therapists do, and their first encounter with occupational therapists would be when a teacher says, I am having challenge with your child focusing in class. They're unable to concentrate, or they're unable to write properly. Their spelling is not, they're not getting right what I need them to teach, you know, what I need them to write down. Then they would be sent for an assessment by an occupational therapist. So an occupational therapist will then do an assessment to find out what are some of the learning challenges that they may have, what are some of the perceptual problems that may be influencing the learning in the classroom situation, and then propose to the parents what is the treatment that we can have that will be able to address their difficulties that have been identified.
Lovely, lovely. All right, so that's in the setting of schooling. All right.
Yes.
Some of us, you know, I grew up in Mthatha, in a village called Tabase, and there were no OTs there. How accessible are OTs? Because whenever people complain about my bad handwriting, I tell them same thing. I started schooling at age of 4, number one, and number two, there were no OTs to actually help me to improve my coordination, fine motor movements, and all of those things. So I'm asking you now, how accessible are OTs? KG? All right, we've just lost Kagiso there. I'm not sure what has happened, but she should be able to join us any moment now. We were still just trying to understand the field that she chose, which is occupational therapy, you know, trying to come up with practical examples of where they add value as occupational therapists. So she explained a lot around what they do in the education, you know, setting, especially, you know, in the earlier years of education. So I was about now to try and understand how accessible, how many OTs are there out there. You know, looking at the population of South Africa, do we have an excess of them? Do we have a shortage of them? Are they clustered around urban centers? You know, if somebody grows up in rural areas, you know, being mindful that 42% of South Africans are actually still in rural, you know, settings. And so do we have access to OTs in rural settings? But the next, you know, area I'm going to get to is actually the role of occupational therapists in workplaces, which is the area where we actually met when we worked together here. So I'm just not sure now why she has, you know, why her phone has decided, to disconnect. But she should be able to join us any moment now. I can see there she is coming in. We need to make up time because we lost about 15 minutes at the beginning. So we need to make up time. KG, are you back? All right, I can see that she's back. Can you hear me, KG? I can't hear you. All right, all right, can you hear me now? I can't hear you. You still need to sort out your audio. You still need to sort out your audio. All right, whilst we are trying to sort out your audio, once she has connected properly, I don't want to spend too much time on this, just to understand, how accessible, the OT skills, in South Africa. Is there a shortage? Is there an excess of OT skills? Where do we find them? And all of that. Kagiso, can you hear me now? KG? I can see you, but the sound is not on. Log out and log in again. All right. All right. So unfortunately, we are in this period of the new normal where we have to use technology a lot. And sometimes technology doesn't always work with us, but because of the load shedding, a lot of people that I've been talking to today, they have been experiencing connection challenges because the strength of the cell phone signals is actually quite weak when, it becomes quite weak when there is load shedding, because the base stations, which are supposed to have backup batteries, some people are stealing those batteries. So the end result is that, we've got poor, connectivity once there is load shedding in a particular area. So I can see her, she's back, but I'm not sure about the sound though. You must connect the audio properly so that I can get, good sound. Can you hear me now?
I can hear you. Can you hear me?
Lovely, lovely. Right. Okay, no, this time I'm not going to blame Arman Skral. I'm just going to blame the people who produce electricity and the load shedding, which normally weakens, the signal in the areas where there's load shedding. So you're forgiven. All right. So KG, quickly, you chose OT. You qualified as an OT. You had told us about what they do in the schooling environment. I want you to tell me, when it comes to adults, where do you guys get involved, especially in workplaces?
Okay. In workplaces, our role as occupational therapists is to facilitate, firstly, we assess employees that are incapacitated, that have been injured, or that have got illnesses that impact on their occupational performance. So in the workplace, an employer would say to us, I've got an employee who's got major depression, and because of major depression, they are unable to perform their duties of their work. As an occupational therapist would then come in and be able to do an assessment to say, what are some of the impairments or challenges that they have? And is it treatable? Can the particular person be treated? Do they need to go into a hospital environment? Or this person can still continue to work? And we then provide the employer with reasonable accommodation to say, this person has got major depression, they are on treatment, they have been to a hospital, they are seeing a psychiatrist, we can provide you with the case management to facilitate return to work based on a particular program. So we then use particular activities to get the person back into the work environment.
So when you talk about reasonable accommodation, are you talking about matching the residual skills with the work demands?
Correct. If somebody is unable to perform the job that they used to do, we then go in and do a worksite environment assessment to say what other positions can they be able to perform based on the skills and experience that they have. We obviously do that in consultation with the employer to say, Ruth is unable to come back as a cleaner, but she's previously worked as a receptionist. And she's got the skills to be able to work as a receptionist. Is there a position where she can be accommodated because, she's got a particular impairment or disability? Yeah.
So if somebody has had a stroke, which affected their cognitive function and also functionally, in a physical function, you guys get involved there as well?
We do. We would do an assessment to look at what are some of the residual skills that they have. We would do cognitive tests. Would do perceptual tests to see what are the residual skills that they have, and then be able to recommend return to work programs to say, can they go back to function in the workplace? Sometimes though, Bele, depending on the severity of the stroke, you may find that a person would need to go on disability benefits for a period of time. And then would go back as occupational therapists to say, I've assessed Mr. X, but based on my assessment findings, right now he's incapable to perform his own or any other occupation at this point. Therefore, we recommend that you contact your provident fund or disability insurer so that you can have them on disability benefits for a period of time until they can recover and possibly come back to work in an alternative occupation or even sometimes the same occupation that they used to do.
Lovely, lovely. So, but in South Africa now, do we have enough OTs? And can they be accessed in rural areas? 42% of South Africans are in rural areas.
We still have a scarcity of occupational therapists in the rural areas, Bele. A couple of years ago, I know the Department of Health had a drive where the newly qualified OTs would need to do their community service and then also do an additional year in one of the outlying areas in order to be able to render services there. What we find is that once we are all qualified, we congregate towards the more urban areas where there are more opportunities. But actually, like you say, there's a need out there in the outlying areas where there aren't really any resources available. So there's still a huge need for occupational therapists in general, but more so in the outlying rural areas in South Africa.
So if there's a mother, or a daughter who's in matric, who's listening to this show, what would you say to encourage them to take up OT as a field, as a career?
They need to be compassionate. They need to be want to make a difference. They need to be patient and be willing to work with people that are often shunned by society or that are seen as different by society. And if they've got a passion for making a difference and for working with people, they definitely need to consider occupational therapy as a career. And we didn't talk about the work life, but occupational therapists work in different settings. There's so plenty opportunities. Like I said, we work with children, we work with adults, we work with hospitals, we work in rehabilitation centers, we work in insurance companies, we work in banks. There are so many settings where functional assessments are important. And whenever there's a need for that return to work and functionality, occupational therapists always play a role. So the scope is very wide and the opportunities are endless.
So basically, there's a lot of demand, and so kids, it's one area, it's one profession that they could, consider, where they are likely to have jobs or can even employ themselves.
Oh, definitely. That's one of the spin-offs.
All right. Okay. So you did your junior work, as an OT after you finished schooling, varsity. And then you went back to become a lecturer. Why?
It happened by chance. After I did my 2 years of work at Ga-Rankuwa Hospital, I developed an interest in sharing with others and teaching. And I found that the more I did that, the more I actually understood occupational therapy as a profession, the role that occupational therapy plays in general within the community. I started in psychiatry and in doing some practical work with students in the psychiatry field when I was in Medunsa. And then there was a position that got open at VETS. And I was offered the position, actually. I didn't even apply. I was offered the position because of the work that I did. And I thought, why not? This is something that would be interesting for me. Coming from a background where both my parents are teachers, it's something that was in me. And I felt that there is knowledge that I could impart at my young age, yes.
and you had unfinished business there at VETS. You remember you played for a year there. You know, you needed to go and change how they know you and see you.
I did. It was an interesting full circle going back to VETS. It felt so surreal because I remember the memories leaving that place were not very nice. Like I said, you know, I hadn't done well. I didn't achieve what I came there to do. But now going back in a different role and being the only Black female lecturer amongst my colleagues was daunting, I must say. I found that a bit challenging initially. It was something that I had to adjust to. I had to learn how to interact and present myself in front of learners or students. I had to be confident in my knowledge of occupational therapy as a profession. I had to improve on my computer skills because where I came from, my computer skills were not very great. But when you have to prepare lessons, when you have to prepare exams, when you have to go out and invigilate students, you really need to put on your A game. So being in that environment really, it challenged me, but I learned a lot.
Lovely. And then you left, academia and you joined a big corporate. Why did you?
It was time. I had been at VETS for 4 years and I felt unsettled. And I felt it's time for me to go and see what occupational therapists do besides the hospital, besides working in an academic environment. I felt it was time for a change and I needed growth and I needed new challenges. Then I applied for a position at Alexander Forbes.
Is there some undiagnosed ADD or ADHD, you know, you just you get itchy, 4 to 5 years to get itchy. Okay, you don't have to answer that, but anyway, and so you went into the corporate environment, yeah? I
did. And at the corporate environment, where that's really where I got into the space of disability, incapacity management. I learned a lot about absenteeism management as well. Skills that I never knew that occupational therapists can use in a corporate environment in terms of helping employers manage those particular issues relating to employees in the workplace. So it was time that I spent there, and I learned a lot of skills in that regard. In the time that I was there was also introduction of different policies in the health sector. There was introduction of the policy on incapacity leave and ill health retirement, which was a new project that my then employer was engaging on. And I was seconded to that project, really, if one can put it that way. And that project also groomed me because I had to then now start moving outside of the office, engaging with other stakeholders outside of the office, and looking at different type of work within the disability management sector. Yeah, okay. All right, and did you find it interesting? Because now you were away from, you were not, seeing patients like, on a day-to-day basis now. You were sort of pushing paper. It was a different environment, but it was interesting because I could apply to the skills that I learned as an occupational therapist. I still could look at issues around incapacity and impairment and how that had an impact and affected people's performance in the workspace. I wasn't engaging with the patients directly, but it was more paper-based. Fortunately for me, because of the portfolio that I was in, I still had engagements with employers and employees. I still could do case management. I still could do, part of the assessments and seeing clients and getting them back to work from a rehab perspective. So that did assist.
Lovely. So how long did you stay with the big guys?
About 4 years, 3.5 to 4 years.
So that 4 year each again, eh?
that got to me. That got to me. But that part of it was the discomfort, but also the need for growth to some level, because I just felt my career path was not as clear, and I wasn't quite sure what the plans were moving forward. And looking around, I just did not see myself in that environment where I would be in 2 years or 5 years, at that point. And then I felt it's time to move. I need growth. I need a new challenge. Yes.
Yeah. Now we'll skip other things. All right, they're not for public consumption, right? Around how you left and the notice and everything else. Yeah, no, let's leave those.
I don't want to skip that, Bill. I know you said I talk too much.
Okay. All right.
And the reason why I don't want to skip how I left my previous employer is because for me, it was a very difficult time. I did not understand how corporate South Africa works. And I took that being asked to leave, escorted by a security guard. That's how it went. I resigned the previous day. The following day when I arrived at work, I was escorted to my desk, and my laptop was requested and my access card, and I was escorted out of the building. I took that experience quite personally, not understanding that is how corporate would actually manage their risk in terms of from a intellectual perspective, in terms of the projects that they worked on. And I remember sitting in my car and crying, mercilessly, because I just felt I did something wrong. And I remember calling who was about to be my boss then, telling him that I've been, escorted out of the building. And he said to me, go and spend a month, relax, you've got a challenge waiting for you. So yeah, it was a learning curve for me. That was a learning.
All right. So, and then what happened thereafter?
In my restlessness and engagements before I left the big corporate, I had met someone that was going to become quite influential in my career, and we had been working on projects together. I mentioned the pillar, policy on incapacity leave and ill health retirement. We had been attending client meetings, doing stakeholder engagement. And when I discussed with him my dissatisfaction and unhappiness of where I am from a career perspective, we had a conversation, and I was offered a position, or I was asked, would you be interested in a position? And I said, well, it's something I would consider. I sent through my CV, and I can't remember if I was interviewed, but I think in the time that we had spent attending meetings, I was interviewed. I did not know, but I was being observed, I was being interviewed, and indeed, I did get a position at Proactive Health Solutions as their operations manager for their Gauteng office. So Dr. Fundi became my boss.
Okay. All right. But anyway, so you joined us, moving from a big corporate, joining a smaller outfit. That transition, how was it for you though?
It was different. I was moving from a big corporate to a medium-sized health risk management company. And I now had to manage a much bigger team, whilst previously I had a much smaller team of about 4 or 5 people. I suddenly now had easily over 20 employees that were now reporting to me in that office. And I found that with the structure and everything else that was afforded with the previous other company, here I really needed to be hands-on in terms of the work that needed to be done. So I fortunately had boss that gave me the space to be able to learn, but also guided me in terms of the operations and how business works in general. So it wasn't a small role, it was quite a wide role, in a sense that previously I'd never got involved in recruitment. Previously, I never got involved in deciding on the training needs of employees. And suddenly in this position, it was now expected of me to partake and be part of the decision-making in as far as that is concerned. So there was a lot that I needed to learn, but with the leadership and guidance that I had at that point, with a boss that led by example, I'm not giving you a...
yeah. Okay, let's move
on. It was a very good environment. I learned a lot, and challenging, tough. In my second year at PHS, I also enrolled for the course at GIBS, where I did the management diploma. It was difficult because I was still adjusting as well in my role in operations management, and having to juggle the studying and the work and being a mom. I found that to be challenging, but at the end of the day, you make time for the things that matter. And yeah, I pulled through. I learned a lot of skills whilst working at Proactive Health Solutions. I understood operations backwards. I understood the importance of running the company efficiently and the impact of that. I was expected to give presentations and feedback at meetings at EXCO level. And fortunately, because I had a leader that believed in me, even got to present at EXCO level, at the board level. So that was a learning curve for me, and it was preparing me for something else, yeah.
Yeah, and then another year, 4, 5, you started to be itchy again. But this time itchy in a different way. You were not looking for employment. You were looking to employ yourself. Yeah, talk to me about it.
I was looking to employ myself, Bele. I felt it is time for me to go and start up something that I'd leave behind a legacy for my daughter. A company that I would build from scratch and work. I'd often listened when you spoke about the interesting bits of running your own business and company and some of the hardships and challenges that came with it. But I just felt it was time for me to move, and not move into a different position, but move into building something of my own, and something that I would run from the beginning and look at, and watch it grow over time. Yeah.
So you called this entity Remotlotlo, which is a Tswana word. Right? What does it mean?
Remotlotlo is we are proud. So taking pride in your health. Yes, yeah, that's what it means.
Right. And the logo has got somebody who's doing the things. What's in that logo?
I will come back onto the logo. I had to, when you're starting a company, you consult graphic designers, you consult all sorts of different people to be able to give you ideas on what you wanted. And we considered a few logos, and that's what resonated with me at that point. So we settled on that company. Yeah.
All right. But the idea that you were now setting up your own company, were there any anxieties, fears, from a situation where you have a guaranteed salary, to a point where you now have to actually generate revenue to pay your employees and then yourself at the end, yeah?
It is, I guess, when I started, when we go into business, you have the vision, you have the why, you have the drive, and you have the reasons as to why you want to go into it, and you put effort into it. And people say anxiety and fear. I actually was convicted in terms of what I wanted to do. It was a cause that I believed in, and for me, I felt it is time for me to do that. And I felt I'd acquired enough experience previously to be able to go on my own and dive in headfirst and do that. Did it turn out like that? I don't know. It's been 7 years of learning. It's been 7 years of understanding what your client base is and your customer base is. I often heard in my previous boss, Dr. Nyati, would say, you need to make sure that you've got diverse clients in your company that you're servicing. When I went out, my company, I wanted to look at placement of people with disabilities in the workplace, in both skilled and unskilled jobs. I wanted to look at functional capacity assessments and being able to place employees in the workplace, offering accessibility audits to companies. And you are idealistic when you go into company and you've got your goals, but you then get to be challenged by the realities that the ideal may not necessarily be what brings in the money. And then you've got to make decisions at that point to say, what do I go with? Do I go back, or do I remember the why I started? And then you've got to reinvent yourself to say, whilst this has not kicked in, what do I then do? What skills do I do? I'm an occupational therapist. I've been trained to do so many other things. You then learn to introduce those services into your company. So it was interesting. The first year was good. The second year was good. And then you had years where you go down and things become challenging. Yeah.
So it's a transition. You are owning your own business. Some clients take long to pay.
Correct.
You know, especially in the public sector. Correct. Yet you have to pay your staff and suppliers within 30 days. So, you know, I mean, now I'm talking entrepreneurship now. Yes. So, I mean, you obviously had to raise funds somewhere or get facilities somewhere to make sure that the machine continues
running. Like I said, in the first year, Dr. Nyat, I had gone in and when things were not looking bright towards the end of the first year, I decided I'm going to go out, source consulting work that's going to feed money into the company. And that's exactly what I did. I went and I did consulting work and paid through the company and everything was running. I could pay for the offices, I could pay the employees. When you start, you work alone and you think you can do everything. And then you realize a couple of months later that you are going to need assistance. And that's when you get more employees. The second year, I had the option to go and source funding, but then still I felt I wanted to grow organically. I wanted to invest into this company. Whatever it is that we're bringing, we'll reinvest into the company and it will grow. And indeed, I think I got a professional that came to work with me, another occupational therapist, and the company grew in that context, that there was now more of us that could do the work. We're now doing medical legal assessments, looking more at road accident fund victims and doing those assessments. And we did that work for over a period of 3 years. And that money, because we had a 3-year contract that we had signed at that point, was consistent. And the payments came through and we're able to afford to pay for our overheads and pay for the salaries of the employees and so on. I must say, losing some of those people that one trains over a period of time was painful. But that's part of the entrepreneurial journey. And you get to learn that when you're a small shark, the big sharks come and they fish in the pond and they take away, some of the people that you've worked with. But it was that. So for me, I did not go and source funding. I really have just gone in to look at my savings.
The business organically and okay, lovely.
Yeah, I was just too scared. I've had the option to go and find investors, but I really have been wary of those kind of partnerships. And I've said, I've seen partnerships that have worked and partnerships that haven't worked. And so far, I'm still fine. Let me carry this and see how it grows.
All right. So now, from being somebody who is just in charge of operations in your previous employer, this time around, you are the MD. Yes. So how does a normal day or week look like in your current, now that you're running your own business?
Sure. It's different, but I can tell you now, the hours that you put in are nothing compared to any job that you've ever, that I've ever been in. I think, let me say, my typical week starts on a Sunday and it ends on a Friday. My Friday evenings and Saturdays, I refuse to touch anything and I put that, to the side because that is my time off. But from Sunday evening, I start preparing my week to look at what engagements do I have? Do I have any potential meetings with clients that are coming up? Do I have any assessments that I do? Because I'm still quite hands-on in the practice as well. Are there any clients, that I need to be seeing? So on a Monday, I would easily have back-to-back assessments. client engagement, patient engagements that go from 9 o'clock in the morning until 5 o'clock, Monday to Thursday usually. Fridays, it would be the time that I'd go out to be able to recoup the money in the business, because that's also important, to be able to talk to your debtors, make phone calls, sales, marketing, going out to, sell the company and the services that you do. So in a nutshell, that is the mix of, more or less what the week would look like.
But I mean, when you send me your bio, you said one of your strengths is multitasking. So I'm sure it comes in very, very, very handy then in being an MD and then being a clinician and being a marketer, and a debt collector, and
and it's you have to hone in on those skills, Pele. You really, when you're running your own entity, is very different, and a small entity at that. You don't always have the financial resources to be able to look for a debt collection company, because they themselves want the money to be able to recoup the money for you. You don't always have the resources to be able to say, let me go and find a marketer that will market the services. You then say, how do I take advantage of online services? How do I take advantage of social media to be able to advertise the services that you offer in the company? You have to see clients. When patients call and they say, I cannot come at 3 o'clock, I can come at 4 o'clock, but you have to go and pick up, your daughter from school. You then have to make decisions to say which one is more important, and is there, a way that you can get somebody to help you with one of those. So it has helped.
All right. So it's been 7 years. You are the owner of your own company, and you're doing all of these things. How has it been? How has the journey been? 7 years.
It's been an interesting journey. There are days when I look back at the 7 years and I looked at what I've built over the 7 years, and being the achiever that I am, I still think, I still have a lot to get to. I still have dreams in terms of how I want to see the brand growing. I still feel that because of what you said earlier of the need for occupational therapy services, we need to move away from the center, which is Gauteng. The fact that I've got an office in Gauteng, in Centurion, says nothing for me. I need to have an office in the Northwest. I need to have an office in Mpumalanga and offer services that are not necessarily available and easily accessible to members of the community. So there's still a long way. There's been lessons. Pardon?
There's big scope for growth.
There's definitely big scope for growth. There is, there's lessons that I've learned in the time, that financial management of the company, understanding that the fact that you've got revenue, and you've got money, in the books, when the cash flow is not there and you're not able to pay your overheads, you're not able to pay your employees, you're not able to pay salaries, that becomes a concern. So those lessons I want to put into growing the brand and into making, the company bigger than what it is already. It's still small, but there's scope for growth. Yeah.
Now, in the healthcare sector, one big event that's coming up is the National Health Insurance, right? Now, anybody who is serious about being in the healthcare space, they have to factor that when they look at their growth plans. What do you think are opportunities for your kind of entity? Obviously, we don't have all the details about how that is going to work out, but have you started applying your mind around how that will impact, your business positively or negatively?
Well, I think there's scope for public sector and private company partnerships in the NHI, yes. And the fact that we as professionals can contribute towards making the NHI work. I'm a firm and avid believer in a sense that we need to have equal opportunity in terms of healthcare access. And there is scope for training on, therapists that are still being trained, that are still coming up. And companies like myself and the public sector can partner to be able to offer rehabilitation services, to be able to offer treatment services for pediatric services. One of the saddest thing that I've realized is that there's some services that were previously offered in hospitals for kids that are no longer being offered now. That is an example of, to say, the private sector can come in with the public sector to jointly provide services to the community in need. So it's not just about making the money, but it's about paying back and making a contribution in, the communities that we come from and the country at large.
So basically, there are opportunities that will come with NHI, and obviously you need to be accredited, so that they can be able to give you work in the same way that RAF has done the same to you. But what about, Kagiso can only do so much in a 24-hour period.
Correct.
So what about collaborations and some form of, rather than being solo, but finding, obviously like-minded people that you share values with, and you guys create capacity so that you can tackle big work?
It's definitely being in the cards. And I think with them, somehow, sometimes you get ideas, Bele, and they sit there for a while, and then you get COVID-19. That really shakes you into, that kind of, reality to say, this is the time now for you to start thinking outside of the box and start thinking of doing things differently. Instead of doing solo, when you can do so much, so little, why not form partnerships with other therapists where you can, provide support for each other and become a bigger consortium and provide more, because there will be more capacity and resources to be able to do the work. So that is definitely in the cards, and it's something that my colleagues and I have been talking about in the field to say, how can we reach more and be able to do more, together.
Lovely, 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 lovely. All right, we have reached that time now where I need to ask one or two people who know you. Is your mom around? Did she join? Or your sister?
I don't. I see.
Let me see now. Right.
My niece is here. There's a Kagiso Motseto. Yes.
All right. Yeah, let me talk to her. Butu, can you unmute yourself, please? We want to see your face too.
Hi.
Now we want to see your face.
Oh, I'm so sorry. May I please excuse myself with my face? I've been working the whole day and I have not moved from this table. So.
Right. Okay, Butu, how are you related to Kagiso?
I'm Kagiso's niece. She is my mother's younger sister. Yes.
Okay. So I have got 2 minutes. Just tell me about Kagiso. No. What I want is, what are the good things that you look up to her about?
Wow, okay, that's very easy. So when I was in university, I worked for her, actually, as a typist, as well as doing some graphic design for her as I was studying graphic design. Yeah. So my aunt, she is a very helpful person. She's very compassionate and understanding. Yeah. And occupational therapy is very fitted for her, because she's always one person that will always help whenever help is needed, or when it's not. Whenever she feels like at this point something is needed, she's always there to intervene, and I love that about her. She's always been, like I said, when I worked for her, it's usually not easy to work for family, but she made it really easy to start off my career in her company. So yes, she's a phenomenal woman and very powerful, and I love it. Yes.
All right. And she's very loud.
No, we all are. It's a Motseto thing.
All right. And tell me, what are the 1 or 2 things that you think she still needs to work on? I know you are young, but I'm sure, knowing her the way you do, there must be 1 or 2 things that she must work on. No one is a complete package. No one is she's got areas of improvement.
So far, funny enough that you asked that question, I actually approached her a month or 2 ago. Like I said, I'm a graphic designer. I've been in the field since, including working in her company for about 5 to 6 years. And I love her work, and I'd love for her to be able to have a market and be able to reach a greater market so that people can see the things that she does. And we spoke about this. And like I said, as I'm a graphic designer, but I'm trying to get into social media marketing. And she's kind of helping me while I'm helping her, so that she can grow. And I love that, because it's never a thing for her about like, she's not scared of saying that she's lacking in a certain place. She's very willing to learn, and yeah, I love that.
All right. The name of a company is Remotlotlo. We are proud. Are you proud of her? Are you mutlutlu about her and her achievements?
Definitely. Oh yes, definitely. If I had to look at the women in my family, I can't explain to you how they are really inspirational, and they are women that any girl would be happy to grow up in. It's not just about their personalities, but just also in the work field as a young Black woman, where she started off and where she is today. It's something that every Black woman should be proud of, and I'm very proud of her. Yes.
Now, I'm a firm believer in the lift as you rise. So has she been rising? Has she been lifting you guys up? Besides the fact that she gave you a job, what about the other nieces now?
No, definitely. Not only me, but I know many people around her life that would speak just as highly as I have spoken of her.
She's not the kind of person who goes up the ladder and kicks the ladder, and she wants to be,
No.
yeah, I'm the first this and first that.
No, not once has that ever been.
I'm the first one to drive a, what's this car now? A Porsche.
Citroen. Oh. No. I even forgot that she actually let me drive her Porsche without a license so many times. She was just like, go take it.
I don't want to put her in trouble. All right, I'm going to ask somebody else now. Modise Mokgotsi, please just unmute yourself. 1 minute.
Thank you.
Yeah, let's leave Butu. She's going to say things that will put Kagiso in trouble. Modise Mokgotsi.
Yes, good evening.
Good evening, man. Thank you for joining and supporting your friend. Yeah, Kagiso, how do you know her and what do you think of her and her journey so far?
Sure. What being put on the spot, but it's kind of funny that it feels like I've known her forever, and come to think of it, it was physically sort of a brief moment, but very quality moment. And yeah, well, the first time I met her, it's when she was working at Wits, and I think I had visited the province and we chatted, and yeah, something of interest around the profession, so to speak, because also there's still a scarcity of men in it.
Yeah.
So she was very encouraging at that point, and I found it very interesting, come to think of, you know, our experience as Black people and where we're from, but how she encouraged, talk about the ladder and lifting as you go up.
Yeah.
And that's exactly what she did. And I always held her in mind, and you know, a couple of opportunities arose, and yeah, we looked at more phenomenal kind of extraordinary work in OT that we wanted to do. And I believe, you know, she's championed the way in that regard.
All right.
So yeah, that's...
Why is she tense? She's tense as we are talking. It's like there's this one thing she's hoping you mustn't say.
Well, okay, so I didn't even see the video. Well, like I said, yeah, it's amazing that you know, it's one of the people that never leave your mind, so to speak. So I always wondered, we haven't seen each other for years now, but
yeah,
physically, but in the space, you know, we kind of know we're there, and yeah.
All right, thanks, Modise, because yeah, there's Louise who's just come in. So if she can just unmute herself, Louise Bukonyane. If she can just unmute herself, yeah. Hi, Louise.
Hello.
If you can switch on the camera, it would even be nicer.
Hold on 1 second.
Right. You know, I mean, sometimes it's important to get feedback, Kagiso, from people that know you. You know, like I said, it's a long journey. You know, life, and sometimes you need to get feedback, good and bad,
No,
from
it's true. Yeah.
from people who know you, and because it builds you, it improves your self-awareness, it improves your EQ, you know, and you know, leadership and management role and everything else that you do, you can only benefit by getting feedback from people.
No, that's very true. And also because one would not have gotten this far without support, you know, support of family, support of friends, support of church and church friends. Louise is one of those. I'm sure she'll tell you about that. It really has been good for me to have that kind of support because, as you know, as a single mom, it hasn't been an easy thing to get to this point and still be able to raise my now 17-year-old daughter. So yeah, it's good to have all the support.
All right, Louise,
Hello.
I've got 2 minutes, just 2 minutes. Your relationship with Kagiso, you know, and what are the things you like about her, and the things that you don't like about her. I already now know that you guys you go to church together, but yeah.
What I don't like about her, that's very difficult for me to answer. What I do love about her, and I think Buto alluded to it, what an inspirational person she is, and she's always got time for family, friend, or colleague.
Yeah.
She always makes the time, however way she does in her running of her business.
Yeah.
She's always got a moment to spare. She's always handing out advice, which she's really great at.
Yeah.
And I really admire her for that. And she's truly an inspirational woman.
Unsolicited advice at times.
But constructive criticism is the one I would go for. You don't always want to hear it, but it's the truth.
Yeah.
And if I can put it bluntly, she calls a spade a spade. There's no other way about it. She doesn't beat around the bush. There's no running around in circles. If you've messed up, she tells you straight that you've messed up. And if you've done a good job, she tells you straight too. There's no running around about it. And I truly
what you
admire
see is what you get.
Exactly. And in this time, it's what one requires. I mean, she mentioned COVID-19. She's been a true inspiration to us all as a church group. And she's truly a phenomenal woman.
Yeah, well, when she left my company, she was not very strong spiritually, you know. I don't know whether maybe as she got closer to that magical 40, she started thinking that she's getting closer to being recalled. So now she must hook up with people like you, Louise. How have you helped her to strengthen that area of life, which is the spiritual side?
I don't know so much if I've played a role in it. I know there are other people in our circle that have.
Yeah.
And if she says I have, I would be surprised by it.
Yeah.
She's been more influential to me because I see her as an older sister.
Yeah.
So
Lovely.
yeah, truly
No, but you see, when it comes to matters of spirituality, you could even be young, but still guide an older person who had been lost for a little bit, you know. All right.
If you
Anyway,
put it like that.
Yeah. So, but are you proud of her?
There's no doubt about it. I think I tell her every day. And yeah, she's really an amazing inspiration.
Okay, lovely. Thank you. Given Matala. Given, there's a lot of guys, you know, of these friends who are here, there's a lot of guys, and you know, when you used to work with me, that's the problem I used to have with clients, because you know, the male guys would you know, okay, they would not know where the boundary is of client and service provider. All right, Given Matala. Okay, I think Given doesn't want to talk to us. Jabulani Kumede. can you unmute yourself and then just have 1 or 2 words to Kagiso? Jabulani Kumede? Yeah, he just disappeared.
It has disappeared. I think, so sorry, to come in, you did say that I talk too much, but that's one of the qualities and traits about me. You mentioned a very interesting point there about being a businesswoman in the now South Africa, and some of the dark side of it, in a sense of when you go in to look for business, when you've done your business profile, when you are serious about, you know, making a difference, and you are genuinely looking for work, the unsolicited attention that borders on harassment and just on women not being taken seriously. I think that's something that it would be not right for me if I did not talk about it. It is unfortunate that at this time in 2020, it's still something that we are still discussing, that when I come in and I present my business concept as a woman, I'm first seen as, you know, somebody with a face, but not necessarily a brain. And the next thing would be, when are we going out for dinner? And I think that really should stop. And it is unacceptable, it is unflattering, and it is something that men out there that continue to do it, men or women, because I mean, people have got different preferences. It is just unbecoming. It is not acceptable. We should not condone it. And we should not even take it lightly that we still live in an era where people have got to be selling off themselves to be able to, you know, to get work, to get jobs, and for your business to succeed. That is just not the way to go. I've learned very on in my business that you're either going to give me business based on my credentials, or you're not going to give me business. It is fine. If you're not going to give me the business, somebody else will the next, you know, in the next door. So I just needed to bring this in to say that's something that we really need to work against. Yeah.
How have you experienced, you know, fellow women in the areas where you've got business? And I'm saying this, I'm asking deliberately because also there is a situation where people sometimes think some of the people who are stumbling blocks when you're looking for business, being a woman, you know, could be other women, you know?
That is very true.
Yeah.
I think one of the greatest skills or gifts that I have is that I form very good interpersonal relationships with people at different levels. And sometimes, like you mentioned earlier, can be misconstrued for something else. But I engage with people and I'm able to make people feel very comfortable. It is indeed true that you do find ladies that look at you and, you know, they look at the shoes you're wearing, the handbag that you're carrying, and they think, actually, you know, she's my competition and I'm not going to let her through. But you need to understand that some people are giving you that attitude based on their own insecurities. And for me, it's always been about making sure that you don't alienate them, because that receptionist that you are not nice to is the one that's going to hinder your progress, you know, going forward in terms of the business proposal that you want to make. So being kind, being polite, and always making sure that, you know, you do put your best foot forward and not aggravating people, you know, when you're engaging with them. It does become challenging at times. But like I say, you do learn how to interact and engage with females specifically. Yeah.
All right. Okay. So, KG, we're obviously wrapping up now. It's been a long discussion, but young women who are looking to emulate you, you know, I mean, it's not everybody who's got the courage to move from secure professional, you know, setup to actually start their own business. Like you've said, there are a lot of teething problems. There are a lot of challenges, and they keep on coming. What would you say? You know, they've got a dream to actually employ themselves. In fact, in South Africa, we need more people to have their own entities to employ others.
Other people.
After COVID, we're going to have a lot of unemployment. So we need brave people to actually, you know, become entrepreneurs. So aspiring entrepreneurs, what message do you have, especially professionals? When I say professionals, clinical professionals, health professionals, yeah.
Well, it's important that it is fulfilling to be able to work for yourself and to be able to see a baby that you birth growing to a certain level. It is fulfilling to be able to make a difference with the patients and the clients that you interact with. But it is very important that they equip themselves with the skills of how to run a business, a professional business. We in medical school, we learn the art of therapy, treatment, and so on, but the business side of it is what professionals need to equip themselves with. You need to understand the financial statements. When the accountants are telling you about the cash flows and creditors and debtors and all of that, you need to know what it is that they're talking about. You need to understand your regulations in as far as registration with SARS are concerned, because that also will, land you in trouble if you don't understand all of those kind of things. So it's important that in as far as, and as much as they want to engage in this journey, but they also equip themselves with the relevant skills to be able to make a success of their businesses.
Or surround themselves with the people who've got the skills that they can access as and when, whilst they're building their business.
Whilst they're still building their businesses, and who'll be able to give them proper guidance and not find themselves 5 years down the line after having made so many debts or, acquired so many other things that are not necessary. And they may be in trouble at that point.
So what would you say have been the key success factors for you? Because most businesses, entrepreneurial businesses, within year 3, they are gone. All right. That is entrepreneurial ventures, startups. All right. But you have survived year 3, you've survived year 5, you are now in year 7. What would you say is the reason now with you? What characteristics, what qualities in you as the leader of this business that has made the business to still be up and running at this point and still looking to grow bigger and bigger?
Resilience has got me where I am. There's been many times when I felt I needed to throw in the towel, but being resilient and remembering why I started, has kept me going. And also understanding that once you start a business and you start having other people that work with you, under you, is not just about you, it's beyond you. You are now have got responsibility to care and take care of the employees that, are working for you or working under you. And also being, reinventing yourself, being diverse in what you do. So you can't just be stuck in one thing and be doing, I'm an occupational therapist, I'll only do the one thing. You need to say, what other areas can occupational therapists be in? Go out there and look for opportunities. I think one of the famous quotes that I like by Sir Richard Branson is that, if someone offers you a good opportunity and, you've got to say yes, and then go find out how to do it. Initially, that was for me a fearful thing to do, Bele, but I've learned. I mean, you go in and they ask you, can you do this as an occupational therapist? If it's within my scope of practice, I say yes. And then I go read up. I go and sit on the internet. I go Google. I go talk to consultants, to people that know what to do. And then I present myself. So you've got to be able to reinvent yourself so that you come back better and you can continue growing.
Beautiful, beautiful. So to your colleagues, now when I say colleagues, OTs who are used to running a practice in the old way, solo practices, what message do you have for them?
It's collaboration is important. We definitely can achieve much more if we put our heads together and collaborate. If we grow the profession and make sure that we market and people understand what it is that occupational therapy is all about, there's much more that we can achieve. And we need to look at working together much more. There's still quite a silo mentality of working individually as therapists. And that, I think, cripples our businesses, because if you are not there as the person that brings in the money, then there's no income. Whilst on the other hand, if you've got other people that you work with, they can be able to assist you, you can be able to take time off, and you can be able to build a brand and a company that is growing. So collaboration and making sure that you you harness the knowledge and skills of your other colleagues is important.
All right. I was hoping that Mom was going to be here, you know, to also just give us that 1 or 2 words. But what message do you have for Mom?
Sure. Mama, she is my best friend. You and I have been through everything. And I always tell people that if I dropped it now, my mother would know exactly where to go fetch me because we're that close. Thank you for the love that you've shown me, and not just me, but me and my siblings. Thank you for carrying us. When Papa died 10 years ago almost, you've carried us through, you've supported us, you've encouraged us in moments when business was shaky and I felt I just cannot continue because honestly, Pele, it's not always a bed of roses, as you know very well. There are months where you have to prioritize paying your employees, your rental, and as the boss, you've got to make a plan, you know, with whatever else happens. And I'd call on Mom to say, Mom, what do I do? She says, well, you know why you wanted to do this, and I know that you're strong, and I know that you're going to pull through. Keep going, my girl. So, ke a leboga, Mama. Thank you for all the support and the love and the encouragement.
And to your 17-year-old? She's gonna get this clip from YouTube, so you might as well say something nice to her.
She will. It's interesting that she's at an age where she believes she knows everything about the world, but she will learn a bit more, just like we all did at some point. Mateo, you've been the push behind a lot of what I've done. When I've pushed myself and I've aspired to be a better woman and a better mom and a better parent for you. And I can only pray that, you know, life affords you the good things. I'm here to guide you, to hold your hand, and yeah, I'll be here to see you through and making sure that the future is brighter and brighter.
Your younger sister, the one who used to work in Pretoria.
She's still in Pretoria. Yeah. Kia, wherever you are, I know you're my biggest supporter. She says to me, somebody was saying, she says to me that I am the risk taker in the family together with my one brother who runs his law firm. And she says, I cannot do what you guys do on a daily basis. Yeah. And but thank you for having my back. Thank you for understanding me as your sister, for loving me, for knowing my love of finer things in life. She's the one person that knows me through and through. And thank you for the support and for being a shoulder to cry on when times are tough. So yeah, she's been there.
All right. And this one is really to your guardian angel that left you 10 years ago, your dad. If you had to meet him again, as in, you know, what message would you have for him?
Yeah, I was very close to my dad, very close. And him not being around to see all of this, I thank him for the lessons, for the lessons that he's instilled in all of us, he's instilled in me, for the spirit of compassion that he used to display, not just in our family members or his children, but everyone loved him. And he taught us that compassion is important. But also not being fearful, to say you need to have faith. God will provide according to your needs. Go out there and do your best, and God will do the rest. So I thank him for that and for the lessons and for teaching us all of that and for not being fearful. Like I said, he was a man that went into property business and auctioneering and everything that I can think of. And I will go back to school and complete my master's. I don't know about PhD at this point.
And then you have an older brother, right?
No, sister.
Older sister, okay. Yeah.
Yes. To my sister, we call her Nunu, Sis Dineo. She is you know, you've been a big sister to us, and we thank you for just being there. We know we can always rely on you. When times are hard, when I need to drop off my daughter with your daughter, I just go and I call and I say, I'm on the way, and I drop her. And she doesn't ask questions. So it really has been good having your support. Yeah, I wouldn't have made it this far without you.
There's a last one. That aunt who said about the double story. That aunt from the rurals who would tell everybody about the fact that you guys have got double story.
To my aunt that I love very much. Yeah, I hope that I've been able to make you proud. I hope that they look back at the journey that I've traveled, and I haven't disappointed them. I know it hasn't been easy. There's been ups and downs, but yeah, I hope that, you know, I've made them proud to some extent.
Okay. All right. But anyway, thank you, Kagiso. I was supposed to finish this thing within 2 hours, but there's that 15 minutes or so at the beginning where you had some challenges. So my apologies to everybody who's been watching for dragging this thing, but I needed to get a total picture, you know, so that when we look at her journey, we understand where she comes from and some of the things that she went through. And I hope you've learned 1 or 2 things from her, especially also about the field of occupational therapy, and also, you know, the lessons, you know, about entrepreneurship. So thank you to everybody who has joined us. Thank you, Kagiso, Khabo. Thank you very much. And yeah, may you continue to grow from strength to strength. We need more people like you who are brave. South Africa needs more entrepreneurs. And so just continue. It's not always easy, but just continue. You will eventually get to where you want to and make your company to be a business that will outlive you. That would outlive you, you know, and that's what we all need. We mustn't just look for businesses that will die if we die, you know?
Great.
Yes. So keep going. All right.
Thank you, Ben.
All right.
Thank you for having me. Yes, thank you.
All right.
Bye.
Bye. All right, sure.